Hello and welcome everybody. Welcome to the Animal Eye Guy. Today we're going to be talking about a condition called progressive retinal atrophy. So progressive retinal atrophy is a term that we use for a multitude of genetic problems of the back of the eye. We call that the retina, and that's the layer of the eye that will recognize light and then transform it into an electrical stimulus, which will then go through the nerve in the back of the eye into the brain. And for a variety of genetic reasons, that retina can start to atrophy or can start to die. And in that process, patients become blind over the course of several years. Unfortunately, this is a condition which is a genetic condition. We see it in a variety of breeds. We don't have genetic markers for every breed available, and even in breeds where we do have genetic markers, having a negative genetic test result doesn't mean that you're immune against getting this condition. So there's probably a whole array of different types of genes which are responsible for this condition. Unfortunately, yes, this is a bilateral condition, which means that both eyes are affected symmetrically, um, and unfortunately, they will go blind at the same time. Although any breed can get this condition, we do tend to see it in certain breeds more commonly. So Labrador Retrievers, for instance, Cocker Spaniels, poodles, dachshunds. So there's a whole list of dog breeds where we tend to encounter this condition. But any breed can get this. Usually they get it when they're sort of between the ages of 6 to 8. There is a breed difference, so we sometimes see it in poodles at a much earlier age, and spaniels they tend to get it at a later stage, and they tend to get blind at a later stage. But there isn't a breed which is completely immune against this condition. At the early stages, it can be diagnosed just by looking at the back of the eye. So an ophthalmologist who's experienced in looking at the back of the eye will be able to recognize even early stages fairly soon. If there's any doubt, we sometimes do a electrical diagnostic test called an ERG or an electroretinogram, which is similar to an ECG for your heart, but it's an electrodiagnostic stimulation test of the back of the eye. On the picture below, you can see a photograph of the setup, so you can see the patient who's hooked up to all sorts of wires to a computer, and we're doing this in a darkened room in order to stimulate the retina and then get a result from that. And here you can see a retinal function test. So this is kind of the test result that you can see. This is a retinal function test of a patient who's got a normal retinal function. So you can see that initial dip, which then goes into a peak. We call that the B wave. So from the bottom A to the B, and that is the stimulation of the back of the eye. And on this photograph, you can see a patient who's got very poor retinal function. So this is a patient who will go blind with time. And you can see there's an initial dip, but then there's no peak after that anymore. So this patient is already very, very blind, both on paper as well as in real life. As you can see on the picture below, these patients usually present with very wide open pupils. And when we look at the back of the eye, this is a picture of what the back of the eye would normally look like. So you can see this central round structure is what we call the optic nerve. And then we get these little blood vessels which go from the optic nerve into the periphery, and then a patient with underlying progressive retinal atrophy, we can see that there's the optic nerve but an almost complete absence of all of these surrounding blood vessels. So this is already quite an advanced stage of disease. Unfortunately, there is no cure for this condition. So in There are some experimental studies on gene therapy, mainly with human applications, but unfortunately they're not commercially available in animals, and they wouldn't be affordable in animals at this stage either. And they would only be possible for dog breeds where a direct genetic link has been confirmed. But at the moment, unfortunately, there is no cure for this condition, and these patients will go completely blind over time. There are some supplements you can give them to try and help keep the retinal function as good as possible for as long as possible. So there's some supplements called Ocuclo, for instance, which I've got some experience with. There are some studies to suggest that they work very well, and there's some studies that suggest that it doesn't make any difference. In my mind, if one of my patients has this condition, um, um, unless they have any side reactions to these medications, which is very infrequent, I tend to just use these supplements to try and help preserve vision for as long as possible. Fortunately, it's not a painful condition. So the condition usually starts at a certain point in life, so usually sort of at the ages between 6 to 8. However, there are some dog breeds where it can start much earlier, and some breeds it might start a little bit later. Um, but it happens very gradually over a long period of time, and is not a painful condition. And these patients will adjust to their blindness because the progress is so slow. Although there's nothing that we can do to treat this condition, we do recommend seeing them back on a annual basis just to make sure that there's no long-term complications. Unfortunately, if the retina continues to deteriorate, it will release certain toxins from the retina which doesn't work anymore, and these toxins will induce cataract formation. These cataracts can then lead to inflammation. We call that lens-induced inflammation or lens-induced uveitis, and that can then lead to glaucoma, which is high pressure in the eye, or a retinal detachment or dislocation of the lens. And these conditions can potentially cause pain, in which case they would require treatment. So although there's no way that we can fix these patients, we do recommend long-term follow-up just to make sure that they're not in any pain. So thank you very much for watching this video, and I'll see you next time.